Welcome to the Hormone Health Boss Show, where each week we will explore the tools, strategies, and education you need to confidently advocate for your health, reduce your symptoms, and navigate your journey from peri to postmenopause like a boss. I'm on a mission to ensure all women receive the great menopause care they deserve, because no one should feel dismissed, overwhelmed, or left in the dark about their health. This show is empowering you to thrive in midlife, because just surviving isn't good enough. You have a purpose, my friend, and this world needs you at your best. It's time to thrive like the boss you are. Let's get started. Hey girlfriend, welcome to the Hormone Health Boss Show. I'm so glad you are joining me today. Today we're going to talk about a topic that most women don't do a lot of talking about. Many women are embarrassed to talk to their doctors or their girlfriends about this subject, but it's so important that we address it. So if you have ever experienced painful sex, frequent UTIs, bladder issues, leakage, itching, burning, pain, yeast infections, all kinds of symptoms that are going on down there, that's what we're going to be talking about today. It's very common to experience these symptoms in perimenopause or postmenopause, and so many women feel embarrassed or ashamed about them. Maybe we feel like this is something we should be able to fix, or maybe nobody else experiences this, but it is a very debilitating syndrome or condition that can really impact not only our lives, but other people as well. You know, we're talking about relationships with our partners. We're talking about, do we feel comfortable leaving the house because of all of these symptoms that we're having? So I really want to drill down today, let you know what is going on down there, why it's happening, what we can do about it, how we can take control, and some of the warning signs that you can be aware of maybe before they happen. So let's go ahead and get started. Now, even if you have never had children, your pelvic health can take a hit in midlife. I want you to understand that really, really well, because most women think, hey, you know, it's due to the symptoms that we're having down there are due to how many children I have had, how many vaginal births I have had. But it doesn't always correlate that way, because there's a deeper issue going on when it comes to this condition that we're going to talk about today. So it doesn't have to do with how many children you have. It doesn't have to do necessarily with your aging process. It actually has to do with your changing hormones. And what we're going to talk about today is something called Genitourinary Syndrome of Menopause, or GSM. And this is a condition that if we leave it alone and we don't do anything about it, then it is going to progress to a debilitating disease. And that's what we want to avoid. So if you're in early perimenopause and maybe you have no idea what I'm talking about, you don't have any symptoms going on down there yet, listen up, because I want you to know what these symptoms are before they show up so that you can take early action. And if you're in later perimenopause or postmenopause and you've already experienced some of these, we will make sure that we touch on what to do about it today. So let's first talk about some of the facts. It's important that you know this, because this is going to help you realize that you're not alone here, that this is very common and not often talked about. And many women don't even talk about these symptoms with their doctor. They're still embarrassed, shameful, or just don't know how to bring it up. So let's go over some of the facts so that you can realize and understand that you are not alone. And this, unfortunately, is a very common symptom of the menopause transition. So 84% of postmenopausal women actually experience one or more symptom of GSM. 50% of women are going to experience some level of incontinence. So this is beyond the little leakage that happens when we sneeze. This is incontinence, having to wear some type of pad on a regular basis to prevent accidents from happening. This can be really debilitating, right? Women don't want to leave the house if we're not sure what's going to happen down there. Urosepsis can be common in the older population of women. This is actually one of the top killers of women in nursing homes who we once thought this was just due to old age, but we're realizing there is much more to the picture than that. And so frequent UTIs is common. And as we get older, that can then turn into urosepsis, or a system-wide infection that started in the urinary tract. So GSM is chronic, it is progressive if we leave it untreated. So it is best to take early action so that we can avoid the symptoms, because it's always easier to prevent something than to reverse it. But there is hope for everyone. Every woman needs to know this information. So let's talk about why this is happening. Why is this a complication of perimenopause or postmenopause? Well, it all comes down to estrogen. See, estrogen is responsible for over 400 processes in our body, system-wide. There are estrogen receptors all over the body. There are estrogen receptors in our vagina and our vulva and our pelvic floor muscles and tissues. So as we start to lose that estrogen throughout the perimenopausal journey, we can lose elasticity and lubrication. And that's going to lead to burning, itchiness, and dryness. There's also an increase in vaginal pH, and the microflora, or the microbiome that is in the vagina, gets imbalanced. So this can lead to frequent UTIs or bacterial vaginosis or yeast infections. So that kind of burning, itching, uncomfortable feeling going on down there is a warning sign that I want you to pay attention to. So estrogen, as that declines and the vaginal tissue is affected, we can see a thinning, a drying, and actually an atrophy where the vagina shrinks and even the clitoris will shrink. So that is then going to impact libido and orgasms, and of course, the relationship with your partner. As estrogen declines, we also see that the urethra shortens, and that leads to more UTIs, incontinence, and urgency. And then when we look at the pelvic floor muscles, as they weaken due to that low estradiol, then you're going to see an increased risk for organ prolapse in that area, which can lead to uterine prolapse or a cystocele or a rectocele. So many things are going on down there that we kind of aren't putting all of the pieces together until we step back and we look at system-wide what's happening. So these symptoms you experience, these are not just annoying symptoms. They are your body's way of telling you something is going on. Now, just as the gut has a microbiome, so does our vagina, right? So we have microbiomes in our mouth, in our gut, in our vagina, and as we talked about in last week's episode, our gut microbiome changes significantly in perimenopause. That is then going to set us up for a change in our vaginal health and our vaginal microbiome as we progress throughout this time frame. So that's going to lead to those chronic infections, yeast infections, bacterial overgrowth, or bacterial vaginosis that can increase the symptoms that we're talking about here. So we talked about the why. Let's talk about exactly what to look for. Frequent UTIs or burning during urination. Lots of urinary symptoms itself that are going on. So you could have any number of these symptoms. You could have one or two of them, or you could have all of them. But they're all due to the same root cause, which is that low estrogen. So urinary symptoms are going to include burning during urination, frequency, urgency, all of those changes that are going on. Maybe you're going to the bathroom more frequently. Pain, discomfort, especially during intercourse. When those vaginal tissues become very thin, we are much more prone to vaginal tearing, and it can be painful. Some women call it, feel like it's knives in there. Some women experience some level of incontinence. Now, we all kind of know when we sneeze, we kind of squeeze our legs together to prevent any leakage from coming out. But what I'm talking about is it'll start with that. And we all think and we blame that on pregnancy usually. Many of us say, well, I've had 3 kids. But this goes beyond that. This is, it starts that way and then it increases. And more than 50% of women experience incontinence to the level that they have to use a pad on a regular basis. Some become fully incontinent if it's allowed to continue. So it's very important to discuss this with your doctor earlier rather than later. We also can experience pelvic pain or pressure. That can be in the pelvic region, in the perineum, or it can be in the back. And it can even cause constipation. And that is just the result of the tissues breaking down and the pelvic floor muscles becoming dysfunctional. It's not uncommon to see things like pelvic organ prolapse, rectocele, cystocele, and uterine prolapse due to that weakening tissue. So that is then what can cause that cascade of other symptoms with low back pain. Constipation can be a very common thing. And then we can see pH changes that can lead to those yeast infections and bacterial vaginosis that, of course, is going to contribute to burning, itching, and all of that discomfort down there. So a lot of symptoms that you want to look out for and really pay attention to your body. We don't want to ignore these symptoms. So we've talked about what is the cause. We've talked about what are the symptoms. Now let's talk about what you can do to take charge of your health, be the CEO, and reduce the symptoms that are going on down there. First thing that comes to my mind is we always want to get to the root of the issue, and we don't just want to put Band-Aids on this. So many women, when this process starts, when we start to notice symptoms, the first thing we do is add vaginal lubricants, right? Moisturizers, over-the-counter things that we can get, because for many women, painful sex is one of the first things that we notice. So we add more lubrication to this. Now, that can help in the moment, but it's not going to help long term, and it never really gets to the root of the issue. And that's because the root of the issue is low estrogen. So what do we need to do? We really need to look at restoring those vaginal tissues with estrogen creams or suppositories. They can be very helpful in restoring the tissue and preventing atrophy or shrinking. It can also prevent shrinking of the clitoris, which is going to help with libido and orgasms if we address the issue. Vaginal preparations can also be in the form of DHEA, which is another type of hormone, or it can be a DHEA and estrogen combination. Now, there are some over-the-counter DHEA preparations or combinations that you can find on the market, but if you need a stronger dose, then your insurance company will likely cover that if you go through your provider. So keep that in mind. This is a discussion you want to have with your provider. And while we're talking about root causes, let's think through if we are having symptoms down there of a condition that is showing us that our estrogen is low, then we want to think about what other tissues in our body may be affected as well. If you're having symptoms down there, then you're probably having symptoms in other places throughout your body that require systemic estrogen therapy. Now, there's a lot of controversy around that, and in another episode, we'll talk all about hormone therapy and is it safe, is it not safe? But let's think about if you're having the symptoms down there, you're probably having them in other places as well, even if you don't know it. Some of the impacts of low estrogen can be silent, like osteoporosis. You may not even know you have bone loss until you fracture something, but it is a symptom of low estrogen. So if you're having these symptoms of genitourinary syndrome of menopause, then we want to think about not just restoring the estrogen to the vaginal tissues, but also systemically to prevent other diseases as well. And what some women find is if they replace estradiol systemically throughout the body in higher levels, then their GSM symptoms will be alleviated. Some women find that they need both. They need the systemic therapy and they need the local therapy, and that's okay too. The local estrogen or DHEA therapy is a low dose estrogen. And the thing that I love about that is that even if you can't take hormonal therapy system-wide, or you're afraid to, or there's other barriers, things in the way that prevent you from being able to take systemic estrogen, low dose topical estrogen to that area in the vaginal tissues only affects the local tissues. It's a lower dose. It's not going to raise your risk for any disease processes and can be used even post breast cancer treatment therapy, which a lot of women suffer immensely with GSM symptoms after going through cancer treatment. And finally, we want to address the pelvic floor. This is going to go beyond you just doing a few Kegel exercises in your living room, okay? Hiring a pelvic floor therapist can be a game changer. It's really important that you see someone who does possibly an internal exam that can check for pelvic organ prolapse and make sure that there aren't any other things going on down there, and can create and design a plan for you that you can then do on your own at home or with their supervision. So it's usually a combination of therapies that we're going to look at with GSM. It can be the estrogen replacement, whether that's systemic or local. Then we look at pelvic floor therapy. And then we look at just lifestyle in general. Hydration is really important. And I know a lot of women with GSM symptoms start limiting their water intake when the urgency and frequency begin. But that can actually backfire and cause more bladder spasms. So we don't want to do that. We want to think about hydrating well, moving our body well, doing strength training, and eating a diet that is healthy. So let's wrap this up. I want you to walk away today with some really important key information that is going to change your life, okay? If you remember nothing else from this episode, I want you to understand that the symptoms you're experiencing of GSM are common, and it's not related to just getting older. It's not related to pregnancy. It is related to a decline in hormones. And that decline in hormones is going to impact your body system-wide. It can happen at any point during the perimenopause transition or even post-menopause. So it is a progressive condition that if left untreated, it can become debilitating. And of course, that's not what I want to see for you. So it's important to watch out for these early warning signs and to take early action. And it can be prevented and or managed with proper treatment. So don't be embarrassed to have a conversation with your provider. This is absolutely nothing to be embarrassed about. And remember, if you are noticing changes down there, then that's ultimately a sign that your entire body is deficient in hormones. And estrogen and progesterone are responsible for over 400 processes in the body. So any warning sign that your hormones are declining is tipping you off that we need to address that in other ways as well. Ladies, take early action to avoid this. I know so many women who have just dealt with it. They've just stuck it up buttercup, and guess what? It never ends well. It leads to debilitating symptoms. It leads to social isolation. It leads to ruining of relationships. So take early action. If you need help in this area, I would love to support you. If you found this episode helpful, make sure you like, subscribe, and share with a friend. I'm on a mission to help every single woman become their own hormone health boss. So if you're interested in learning more about hormone replacement therapy or functional lab testing, you can click the link in the show notes to schedule a complimentary discovery call with me. And I would love to help you feel like the CEO of your health. All right, girlfriend, that's all for today. I'll see you next week for another episode of the Hormone Health Boss Show.